how do we treat this? If you're sitting there right now thinking that this is me for sure, I've done everything, I've maybe even tried getting my neck treated, but it didn't really work, or maybe it made things worse. That's not necessarily a bad thing either, right? Patients say, oh, I went to such and such a practitioner, and after that, I was so symptomatic, I felt so awful, blah, blah, blah. To me, that's actually a good sign, all right? If that's happened to you, go back and go down that path, because that right there shows you that something was triggered. If there was nothing wrong with your neck, you wouldn't have a response like that. But if there's something wrong with your neck, you could have all sorts of crazy responses. So if they're a good clinician and they have experience in this, they should be telling you that you're likely to feel like crap after the first couple treatments, because that's a common thing. But most patients, especially those with persistent concussion symptoms, have been feeling like crap for so long that they do not want to do anything which could make them feel like crap anymore. Okay? But really what they need to do, and the irony of it, is actually put themselves through a little bit of that to get to the other side and actually make a difference. Okay, so how do we do the treatment? What treatment should you be looking for? This is actually the question that started this whole rant off, but let's look at the evidence. The biggest thing that I see as a problem, and kind of is picked out in the evidence as well, is that you shouldn't be doing things in isolation. And this is what I see a lot of times, is that patients will do one thing at a time. Okay, well, I don't want to start doing anything with my neck because I'm currently doing vision therapy. Okay, but like I said, the systems work together. So if you're doing vision therapy and there's an issue with your neck, you're going to plateau on vision therapy. And then you're going to think vision therapy doesn't work. That's not the case. The vision therapy stopped working because you have neck issues that aren't being addressed at the same time. Okay, same thing goes with vestibular function. If you have a vestibular abnormality and somebody's working on your neck, your vestibular function will try to make your neck tight as a reaction so that you stay stable, so that you don't feel dizzy. Well, guess what? Your neck's just going to tighten right back up. So if you're not getting the vestibular issue addressed, the neck treatment is going to not last very long. So the number one thing that you should not do is do things in isolation, because you will hit roadblocks. So you have to kind of tackle this in a simultaneous way. Now, you can do this by seeing multiple practitioners, or you can find one that has actual specific concussion training that knows how to do, the basics on all of these things and knows how these systems work together, that can give you kind of a more cohesive rehab management strategy. So the best evidence seems to support what's called cervical vestibular therapy, so involving neck treatments with vestibular, and you can lump in some ocular motor stuff there, because some of the central vestibular stuff involves a lot of ocular motor function. So combining it with other therapies in a simultaneous fashion. So please do not say, oh, I don't want to start that yet because I'm going to do this and I want to see how that goes first. You will get nowhere, because you'll do your vision therapy, you'll hit a roadblock. Then you'll go over and get your neck treated, but all the gains you made from vision therapy are now disappearing, and you're hitting roadblocks with your neck because your vision system is holding you back again. It has to be done in a more cohesive way, and I think that patients would get a lot better if they thought in that way of the systems work together, let's work them together. That's how it works. Okay. So what type of treatment should be included? What type of treatment should you be looking for? Most of the evidence supports the use of a combination of various things, including manual therapy and rehabilitation exercises. So in the manual therapy side of things, that could involve soft tissue work, so massage, active release therapy, vibration therapy, anything to loosen up muscles with a little bit of manual work. Right? And I get a lot of relief on this if somebody has, let's say, an issue with their left-sided SCM muscle. That'll tell your brain that your head is tilted and rotated, right? So you go in there, you start working out SCM, and then the muscle, all of a sudden the signal immediately back to the brain is that the head is level, and they feel immediate relief. So this is something, manual therapy, if you know what you're doing, you can get in there and you can literally make somebody feel as if they have no symptoms within a few minutes. It's incredible, okay? But it won't stay, because you also need the rehab side of things. Other manual therapy techniques that are also important are joint mobilizations. So Anytime your joint is stuck, it needs to get better movement through it, so you can do joint mobilization. Sometimes these are things like long axis distraction or just various mobilization techniques for joints. And then the next one up from that is manipulation. People often think of this as getting your neck cracked. Okay. Now, this is something that usually would be done by a chiropractor, but other professions can do it as well. This one is an important one, and oftentimes people are afraid of it. They think their neck is cracking, it's breaking, it's there's some danger to it. Obviously there are some risks to it, but it's not as high as you would think. You actually have more of a chance of getting hit by lightning twice in your life than having any serious adverse event from neck manipulation. It's an extremely, extremely rare thing to have any adverse effect from this, and it's super, super important. The reason why it's important is because your muscles respond to what's going on at the joint level, okay? If you think of when you go to move something, the first thing your muscles will do is make sure the joint that it's about to move is stable and sitting in the right place. Then once it knows the joint is sitting and stable in the right place, then it'll generate force, okay? If you've ever noticed that if you have like a hip issue or a knee issue where your knee hurts, you cannot generate any force. You're so weak, right? Or if your hip is messed up or if your low back is in pain, your glutes just don't fire. You can't generate any strength whatsoever. It's because when the muscles go to check, is the joint stable? Can I actually perform this force without hurting myself? The muscles will realize that the joint is not sitting in the right place, not stable, and it won't be able to allocate any force. So if you were just to go and get, let's say, a massage, that may give you some temporary relief on the muscles. But if you have a joint issue, and as soon as you leave that place, the muscles are going to tighten up around that joint as a protective mechanism, and you're right back to square one. So oftentimes people are afraid of the manipulation side of things, but the manipulation side of things is often the most important piece to this, because if the joint gets unstuck, gets moving properly, then the muscles can relax. If the joint stays stuck, it not only creates inflammation and its own headaches and its own referred pain up to the head itself, but then the muscles tightening up around it kind of compound that effect. So manipulation is an important piece of this puzzle. So don't be afraid of the manipulation side, because that is often the ticket. That's the key to get things moving and firing well, and the muscles to let go, because sometimes the muscles just won't let go. The reason is likely because there's some sort of joint issue going on that's holding things back. Okay. Next, rehab. Postural strengthening and neck stability. That's kind of where you want to go, and also proprioception. So proprioception is where you are in space, right? Proprioception is my arm is straight. I don't have to look at my arm to know that my arm is straight, because the sensors in my muscle tell me that my arm is straight. That's proprioception, knowing where you are in your body. So proprioception of your neck is, where is my neck in relation to my eyes and my head? So some of the things you would work on, for example, is we have little laser pointers that go on a helmet or on a headband, and it will point at a target, and we'll get the laser right in the center dot of the target, and you close your eyes and you turn your head all the way to one side, and then you turn it back to the middle, and you try to feel, keeping your eyes closed, you just try to feel where you were previously. And when you think you're on that target, you open your eyes, and then we measure how far off that target you were. And then you practice it. Because by practicing that, you get better at sensing where your neck is in space. And if you get better at sensing where your neck is in space, you form a less of a disconnect between your eyes, your vestibular, and your neck muscles, so you don't feel as dizzy. If you don't feel as dizzy, your muscles can relax because it has better proprioceptive sense. They're not just jacked up trying to keep everything rigid. They can relax a little bit, and it's helpful. So proprioception is a big part of this. So rehab, stability is big, okay? Not just strength. You don't just want to have a huge neck. You want to be stable and functional in terms of your neck, again, to know where you are in space, right? What happens first? Muscles stabilize the joint, then they move. If the joint is unstable, not sitting right, then you're not going to be able to move properly. You're going to get tightening of muscles. So you want to work on joint stability as your rehab exercise. Acupuncture. So there's some evidence that local acupuncture, meaning put into certain muscles, can relieve headaches, can relieve dizziness, and there was actually one study that showed that it improved cognitive function. I don't know how that works, but it did. It showed improved cognitive function. And it was actually an RCT, so it was a decent study, small sample size, but showed that it did increase some cognitive function. So I use acupuncture on the majority of my patients. I usually do a little bit of stim work with it, but I'll put it in muscles that are hard to release. Like if I got a muscle that's jacked up and won't let go, I'll stick an acupuncture needle in there and I'll give it a little bit of stimulation, and that will relax. And the reason why that works is because it actually messes with the muscle spindle firing frequency. So you got muscle spindles in there that are just jacked up and firing constantly. They have this kind of feedback loop where they keep the things tight. And so if you go in there and you mess with it with a little bit of stimulation, it'll kind of rewire their frequency, and next thing you know, the muscle will just kind of relax. So it's a really good tool to use clinically. So basically, if you want to have effective neck work, you need to have the manual therapy side and the rehab side. If you're going to somebody who's just giving you neck exercises, that'll work, but it'll take 3 years. Okay, it'll take you forever. If you're going to somebody who's just doing manual therapy, that will provide you likely with some immediate relief. It'll probably kill you the first couple times you do it, but then it'll get better. It'll probably provide you with some immediate relief, but it won't give you any long-lasting recovery because the strength, the stability, the proprioception is not there. So they're giving you a new neck here, but you have to learn how to work it here. So you need both in that sandwich. So you need to have your manual therapy and you need to have your rehab, because the manual therapy will give you that immediate relief, but it's not going to stay. So who should I be looking for? Who should I go see? Should it be a massage therapist? Well, massage therapist only covers one box. They're going to give you some soft tissue relief, but you don't get the joint relief, and generally they're not going to give you any rehab. So you might want to go, might make you feel good, but don't think that that's going to be the way to get rid of your neck issues. It's not enough, okay? Acupuncturist, again, that's one box, right? They might be able to provide some soft tissue relief. There's acupuncture techniques that can reduce your sympathetic and increase your parasympathetic tone, and some systemic points that might help you to just feel better and more calm, but you're not getting to the joint problems, and you're not getting to the stability issues, and you're not creating increased function of your neck. Chiropractor. Well, that depends. I am a chiropractor, but if your chiropractor is only doing adjustments, then that is missing a big chunk of what also needs to be done, right? Some chiropractors, you go in, all they do is crack, crack, crack. They don't do any type of soft tissue at all. Sometimes you go in and they put little pads on you, and then they come in and crack, crack, crack. Those little pads don't do anything. They might make you feel a little bit better because they mess with your nervous system, but they don't actually provide any therapeutic benefit beyond kind of some short-term pain relief. So if your chiropractor is only doing adjustments, the answer is no. That's not where you want to be. So you want to go to somebody who's proficient in soft tissue work, maybe does some acupuncture, does some adjustments, and also provides you with the rehab so that it kind of keeps things going forward from that point. PT, same thing. It depends. Should I go to a physical therapist, physiotherapist? It depends. So do they do only manipulation, or do they even do manipulation? Do they just do soft tissue work? Do they do any soft tissue work? I know some physios that only do rehab. They don't do any manual or hands-on. Generally, in my experience, most physios or PTs aren't as proficient as chiros with their manual skills, but chiros aren't proficient with rehab as the PTs are. So it's kind of sometimes, and in a lot of cases in my clinic, for example, I will do a lot of the manual work, refer to the PT in our clinic to do a lot of the rehab stuff, and we kind of work together. So either find somebody that does all of those things, or a team that has those in-house that you can kind of work with. So in summary, let's summarize this thing up here. The neck is always involved in concussion. Always, 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 if it's an impact-related concussion. One of the most common causes of persistent concussion symptoms is neck dysfunction. It is best treated when combined with other therapies that are targeting the other issues such as blood flow, vestibular, ocular motor, psychological, hormonal, everything. Don't do neck rehab as a silo and think, that it's going to work. Don't do any concussion rehab as a silo and think that's going to work. Best treatments are a combination of soft tissue, acupuncture, joint mobilizations, manipulation, and rehabilitation for strength and proprioception. And obviously, it's best paired if you're also doing ocular motor rehab, vestibular rehab, and all those other things that go together, because the systems all work together. You can't just do one. Your best bet for all of the above is to find a concussion-trained clinician or team that knows this stuff, knows how it works. I can obviously only speak for Complete Concussion Management because we are the ones that provided their training, but they definitely do know this stuff. So if you are looking for a clinic, go to CompleteConcussions.com and you can find a clinic near you.